Welcome and thank you for joining us at today's benefit presentation. My name is Pat Salas and I am the president of ESPIS, South Bay Health and Insurance Services. We're an insurance agency that specializes in helping people with Medicare find the plan that best suits their needs. We do this by reviewing plan benefits side by side, helping you to understand them, and assisting you in enrolling into the plan that best fits you. All of our services and assistance are free of charge to you. Today, I will cover a number of disclosures that the Centers for Medicare and Medicaid Services want you to be aware of and know about. To begin, we would like you to know that ESPIS and our agents are contracted with every plan that will be covered today. The agent will explain which companies he or she will talk about and what plans will be covered prior to beginning the presentation. Your agent will now indicate what plans will be covered today. The services ESPIS agents provide are at no cost to you. We are compensated 100% by the health plans. Anytime we write an enrollment, the health plans that we are contracted with pay us for those enrollments. It is important that you understand that ESPIS is an independent agency and our agents are independent also. That means we do not work for the Centers for Medicare and Medicaid Services, the Social Security Administration, or your physician's office. We do, however, have a relationship with all of the health plans we will cover today, and because of that relationship, we may present them to you and assist you in enrolling into their Medicare products. The plans you will be shown today renew their benefits and contracts with CMS every year. That is why it's important to attend a presentation such as this one on a yearly basis. You want to make sure that your benefits have not changed, and if they have, that the plan you have continues to be the one that makes the most sense for you. Now, I will show you how the different enrollment periods work, what they mean, and why it is so important for you to understand them. Please take note. Let's talk about when you can join a plan. The very first period we will cover is known as the initial election period. This period opens 3 months prior to your birthday month, the month of your birthday, and 3 months after that. Traditionally, it's when you turn 65, but there are some exceptions. During this time, you may join a Medicare Advantage plan or a prescription drug plan, and you may change your plan selection until the day your benefits become effective. The open enrollment period, also known as OEP, begins on October 15 and runs through December 7. During this time, you can review, renew, or enroll into a plan of your choice. During OEP, you can join a Medicare Advantage plan that includes drug coverage or not. You can change the current plan that you have into another, or you may also enroll into a standalone prescription drug plan. The changes you make will become effective January 1st. The annual disenrollment period, also known as ADP, begins January 1st and ends on February 14th. Members that are already part of a Medicare Advantage plan may choose to leave their plan and return to original Medicare fee-for-service. During this period, you may also add a standalone prescription drug plan. Please remember you will not be able to switch from one Medicare Advantage plan to another during this time. You will only be allowed to add a standalone prescription drug plan to your original Medicare. The lock-in period runs from February 15th through October the 14th. During this period, you are generally not allowed to make any type of changes. The only time you are allowed to make changes during the lock-in period is if you qualify for a special election period. In order to qualify for a special election period, you must meet certain circumstances. These include moving from one county to another, qualifying or losing eligibility for Medi-Cal, as well as many others. Please consult with your agent as to what events may qualify you for a special election period. In order to qualify for a Medicare Advantage plan today, you will need to meet the following 3 requirements. Number 1, the Parts A and B of your Medicare must both be active. Number 2, you cannot have end-stage renal disease or ESRD. That means you cannot be on dialysis. And finally, you must live in a plan-covered area. We will give those to you later today. In addition to the Medicare Advantage review you will have today, in some instances, we will also cover special need plans. These plans are divided into two categories. One for people that have chronic illnesses and meet the medical conditions required to join them, and one for people with low income. If you're in one of the counties where these plans are offered, they will also be explained to you today. Now that you know whether or not you qualify for a Medicare Advantage plan, it's time you understand how these Medicare HMO plans work. When you choose a Medicare Advantage plan, you must also choose a primary care physician. The primary care physician will not only care for you, but he will also refer you out to specialists when necessary. Your primary care doctor will have access to a network of specialists to work with that are contracted with the same medical group he belongs to. Your primary care physician, network of specialists, medical group, and health plan all work together to provide you with the best type of care possible. Please note that in most cases, your primary care physician must do the referrals for you. You as a patient may not self-refer to a specialist. If you do, you could be responsible for 100% of the out-of-pocket cost for that visit. Please, whenever specialty care is required, make sure you visit your primary care physician and have his office get prior authorization before you receive the service. If you ever need emergency or urgent care, these services are available both in and out of network. Original Medicare does not cover most prescribed drugs. However, the plans you will hear about today do. We will show you a slide that clearly explains how the prescription drug coverage works. The Medicare coverage gap, or donut hole, begins once you reach your Medicare Part D plan's initial coverage limit of $3,310 and ends when you spend a total of $4,850 this year. In 2016, Part D enrollees will receive a 55% discount on the total cost of the brand name drugs purchased while in the donut hole. The 50% discount paid by the brand name drug manufacturer will apply to getting out of the donut hole. However, the additional 5% paid by your Medicare Part D plan will not count towards your true out-of-pocket maximum. For example, if you reach the donut hole and purchase a brand name medication with a retail cost of $100, you will pay $45 for the medication and receive $95 worth of credit towards meeting your 2016 total out-of-pocket spending limits. Enrollees will pay a minimum of 58% copay on generic drugs purchased while in the coverage gap, a 42% discount. For example, if you reach the 2016 donut hole and your generic medication has a retail cost of $100, you will pay $58. The $58 that you spend will count towards your trip. Your agent will now show you a sample of a formulary for each of the plans they will cover today. The formulary is the official list of medications covered by the health plans that you as a member have access to and coverage for. Covered medications are broken down into tiers. Each tier dictates the copay level or amount that you are responsible for when you receive the medication. It's important that you know how to find the formulary in the event you don't have one handy when you're at home. Please note that you can find the drugs listed on your plan's formulary by visiting www.medicare.gov under Plan Finder. You may also find them by visiting your plan's website. And finally, you may call your plan's member services department and ask them to send you a hard copy by mail. When choosing a Medicare Advantage plan, one of the most important exercises you have to do is check your current prescriptions against the plan's formulary and identify which tier your medications fall under. This will clearly indicate to you what to expect when it comes to out-of-pocket costs or copays related to your medications. Some prescriptions listed on your plan's formulary may require step therapy. That means that it is required for you to try certain medications before others are approved. Some drugs may require prior authorization, and that is the process of obtaining approval for certain prescriptions before they can be dispensed. If you're a new member to your health plan and have drugs that are not covered on the formulary, you may be able to use the transition period benefit to get those drugs covered during the beginning month of your enrollment. If you need to do this, please contact Member Services with your plan and have your provider assist you with getting coverage during this transitional period. Network pharmacies are pharmacies that are contracted with the health plan that you choose. You must use these pharmacies in order to get prescription coverage. You may go outside these pharmacies if you have an emergency situation. Part D is prescription drug coverage. It is not mandatory, yet all of the plans you will be presented today include it. If you're someone that just became Medicare eligible and you did not choose a Medicare Part D plan to go along with your original Medicare, you might be responsible for penalties up to 1% per month of the national premium average for not having had Part D coverage. Your agent can give you more assistance and provide additional information. Finally, if you're considering a Medicare Advantage plan, it is important that you understand the plan's star rating. Medicare uses information from Medicare satisfaction surveys, plans, and healthcare providers to give overall performance star ratings to plans. A plan can get a rating between 1 and 5 stars. A 5-star rating is considered excellent. These ratings help you compare plans based on quality and performance, and these ratings are updated each fall and can change each year. Now your agent will provide you with the star rating for each plan that will be presented today. We're going through some difficult times in our economy today, and that might be the case for you at home. If so, we will show you ways of getting additional assistance if you need it. There is extra help available. If you qualify, it might help with paying for your drug plan monthly premium, your deductible, co-insurance, and co-payments for prescription drugs covered on your plan's formulary. The extra help can also help you with avoiding the coverage gap, and it can help if you missed your initial enrollment period. You already qualify for additional help if you have one of the following: Medicare and Medi-Cal. You receive help from Medi-Cal paying for your Part B premium, or you have both Medicare and receive a Supplemental Security Income Check or SSI. If you do not have any of these, you might still qualify for extra help by applying for low-income subsidy. If you want to know if you qualify for extra help, you may reach out to one of the following: 1-800-MEDICARE. TTY users, please call 1-877-486-2048, 24 hours a day, 7 days a week. You may also call the Social Security Administration at 1-800-772-1213. TTY users, 1-800-325-0778 from 7 a.m. to 7 p.m. Monday through Friday. If you would like to apply for Medi-Cal, you may do so by going to your local Medi-Cal office. Most of these options can be discussed with your agent today, and he or she can provide you with further assistance. Our agents are very well trained on the options and can further assist you. In fact, most of our agents can help you apply online for low-income subsidy today. As a Medicare beneficiary, you have certain rights when you join a Medicare Advantage plan. As a member, you have the right to file an appeal or a grievance. Appeals have to do with financials. If you get a bill and you get charged an amount that you do not agree with, you should contact the plan and challenge the amount through the appeal process. A grievance has to do with the quality of a service that you received or something that happened that you were not satisfied with. You may file your appeals and grievances directly with the plan by calling their customer service department, by mailing them a letter, or by calling Medicare directly. You may also ask your agent to assist you with placing this type of complaint, and they will gladly help you. Once you complete your enrollment application for the plan of your choice, it will be submitted to the plan. Once the plan receives it, it will be sent to CMS, where it will be approved or denied. Once it is approved, you will receive a letter welcoming you to the plan. Right after, you will receive a new member welcome kit as well as a new member ID card. You will use this new ID card in lieu of your Medicare card whenever you receive medical services. Please make sure to use the card whenever you visit your primary care doctor, your specialist, or receive any type of care through the plan. Once you're enrolled into a plan and you are an active member, if you were to decide that you no longer wanted to be in that plan, you may disenroll from it. In order to do so, you must request this in writing. If this happens prior to the effective date, a phone request to the plan is enough to disenroll. If you choose to disenroll after the effective date has passed, a written request is required to take you out of the plan. You may also disenroll or cancel by calling 1-800-MEDICARE. It's important you understand that if you disenroll from a plan, you will be returned to original Medicare fee-for-service with no additional coverage. Please, prior to making this type of a change, consult with someone and make sure you understand the issues that could come from having original Medicare only and no prescription or additional coverage. I am now going to hand the presentation over to your agent. He or she will let you know about those wonderful benefits you came to hear about. Thank you so much for coming to our presentation. It's our pleasure to serve you. I wish all of you the very best and much health.